Hi, everyone. Jessica Brown here, clinical nutritionist, compassion teacher, and a person going through menopause. So, in my last video, I talked about how I have personally made the decision to go on a microdose of a GLP-1 medication to help with my menopause symptoms. In this video, I want to talk about why. What's the science behind it? Why would somebody choose to microdose a GLP-1 medication for menopausal symptoms? This is completely off label. Science hasn't proven anything yet. However, if we start connecting the dots and we look at what's happening in menopause and how GLP-1 medications impact the female body, we can see that there is a lot here that we can sift through, and it might be a good argument about why it could be the right choice for you. So let's talk about what happens when a woman goes into menopause. We know that a woman going through menopause secretes lower amounts of hormones, less estrogen, progesterone, testosterone. Why is this important? Well, when that happens, it triggers chronic inflammation and it's an immune event. Now, this is really important because when I went to all three of my doctors and I said, yeah, I'm starting to go into menopause, no one sat me down and said these two important things that I'm going to tell you right now. Number one, menopause is an immune event that our bodies go through. And number two, menopause puts us into a chronic state of inflammation. This is triggered by the decrease in estrogen. A decrease in estrogen promotes a state of chronic inflammation. Yet another thing I wasn't told. It's so frustrating because in some ways I feel like women who go through menopause, it's like it does us dirty, right? It's just really challenging, and we're not given very many resources. It's just been in the last few years that the Women's Health Initiative study was closely looked at, and now it's suddenly safe to put women on hormones. But the big question there is that enough? We know that hormones are incredible. They help a lot. They help lower inflammation. They help with chronic illness associated with menopause. But I think that there's not enough emphasis placed on the fact that menopause is an immune event that puts a woman into a state of chronic inflammation. And the chronic inflammation is the piece that GLP-1 medications can really help with. And this is the part that not a lot of people are talking about because GLP-1 medications are sort of seen as weight loss medications, right? Estrogen is incredibly anti-inflammatory. It helps regulate the immune system. So without it, or even if we're on HRT, is it doing enough? Well, for many of us, it isn't. I know for me, I was on hormone replacement therapy for over 2 years, and I still was having really uncomfortable menopause symptoms. Menopause symptoms are sort of seen as it just goes along with the menopause territory. You might get hot flashes. You might have painful joints. You might even have a relapse of your autoimmune disease. Why? Because menopause is an immune event that puts a woman into a chronic state of inflammation. So we can stay on hormones, but the question here, this is a question I ask myself, should we add small amounts of GLP-1 medications? For me, the answer was yes. So let's talk about what GLP-1 medications are doing in a menopausal body to lower inflammation and help with immune cells. If you dive into research, you can see that GLP-1 medications are already shown to be powerful immune modulators. They help with B cells. They help with T cells. Those are fancy names for the things that sort of dysregulate our immune system and help our immune system run better. They also help lower something called cytokines. Cytokines are inflammatory chemicals that our body makes when it's in a chronic state of inflammation. Look, we know that an unhealthy diet can cause inflammation. We know that a really stressful life can cause inflammation. We don't necessarily talk too much about how normal life changes also cause chronic inflammation, like menopause. So women are sort of thrust into this natural inflammatory state. Sometimes we're given hormones to help. Oftentimes we're left to our own devices. There's very few resources, I think, that really help women. Certainly, we're not being told by our doctors, this is what's happening, and here's some options that you can implement into your life. I am a nutritionist. I have an arsenal of things that I have been teaching my clients and my students for years that sort of promote this anti-inflammatory lifestyle, like the Mediterranean diet, like vitamin C, like glutathione. These are things that people in functional medicine nutrition have in their arsenal to help lower inflammation. And why do we want to do that? The lower inflammation you have as you age, the less risk for chronic illness you have. When we look at what is the biggest killer of women after the age of 50, it's cardiovascular disease. 1 in 3 women are going to die of cardiovascular disease. That's heart attack, stroke, complications for type 2 diabetes, high blood pressure. These are things that we want to see in low amounts in people going into old age and the second half of their life, or menopause. What's important to remember about the chronic illnesses that primarily impact women as they age are that they are diseases of inflammation. Cardiovascular disease is a disease of inflammation, and we want to incorporate all the tools that we can to lower inflammatory states so we don't get diseases of inflammation. Does this make sense? So we want to, of course, live a healthy lifestyle. We want to have a low inflammatory diet. We want to move our bodies. We want to build muscle. But we want to remember the name of the game as we age is keeping inflammation low. GLP-1 medications are being shown in science to help with the very thing that puts a woman going into menopause at high risk. Is it going to solve all of our problems? Absolutely not. It's always a blend of lifestyle factors, of attitude, of looking at your belief system. But it's important to know that it's something that you can ask your doctor about, even if they haven't heard about it. It's something to spend some time researching if you haven't already. Again, science hasn't shown that microdosing GLP-1 medications are an effective treatment for menopause, but when we look at the research and we draw conclusions on our own, we can see that it might be a helpful off-label use of the medications. The big takeaways I want you to have from this video are a few things. Number 1, that menopause is an immune event. And when we have an immune event that's provoked by the loss of estrogen or the decrease in estrogen, chronic inflammation can happen as a result of this. And this is the message that isn't getting out. When we are a woman going through these transitions, a lot of our uncomfortable side effects or symptoms of menopause, like hot flashes, brain fog, dry eyes, stiff joints, are actually not just a symptom of menopause, they're symptoms of inflammation from menopause. Once we understand that, then we can open up ourselves to bigger and better resources to help lower that inflammation. For me, GLP-1 medications were one of the tools that I used, but I think it's important to talk about this so you know that maybe it could be a tool for you as well. So I'm curious what you think. Also, I'd love to have you be on the ride with me as I go through this and I share more information, but I'd love to hear your story too.